If you're bothered by eye glare, then this video is for you. So eye glare can happen when something scatters and distorts the incoming light to your eye before it reaches a part of your eye called the retina. So also it can happen when the brain's visual pathways become extra sensitive to light. This can make it hard to see clearly, especially in bright sunlight or if you're driving at night. There are 10 common reasons for having eye glare and 2 reasons that are a little bit more serious, which we'll also talk about. So be sure to stick around till the end of the video. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist and you're watching the eyefacts.com channel. Let's jump into the 10 most common reasons for eye glare, then we'll get into the 2 more serious reasons, and then we'll finish off the video with what you can do to reduce your eye glare. So the first and most common reason for having eye glare is having dry eye. When you have dry eye, the tears do not spread evenly across the surface of your eye. Because the surface is not smooth, it can scatter light, and this can cause blurry vision as well as eye glare. Dry eyes can make you very sensitive to light as well, which is something that we call photophobia. Another important reason for having eye glare is having uncorrected visual issues or vision problems. This is especially true in the case of astigmatism. There's another video on the channel all about astigmatism, and if you have astigmatism and it's uncorrected, the light can scatter and also cause eye glare. Irregular focus from astigmatism can also cause halos as well as glare, especially at night. The third reason for having eye glare is having a cataract. Now, a cataract is a normal aging change. It's like getting white hair. So when you have an early cataract, you may not actually have vision issues in terms of seeing the chart, and your vision still may be very good, like 20/20 or 20/25. But we often do something called glare testing, which means that we shine a light near your eye and then ask you to see things. So this can actually be a reason for having cataract surgery done earlier if glare is a significant problem for you as you're getting older and you have cataract changes in the eye. Patients with early cataracts may especially notice glare when they're driving at night. The fourth reason for having eye glare is a corneal surface irregularity. The cornea is the front surface of the eye, and sometimes if it's not shaped right because of an irregular tissue that might be on it, such as something called a pterygium or a pinguecula, this can also cause eye glare, and some of that's also going to be related to the dryness that is associated with these issues. Another common corneal surface irregularity is a scar. So if you've been hit in the eye or you've had metal to the eye at some point and we've had to go in and take that metal out for you, this is something that you would remember going to the eye doctor for. This down the line could lead to a corneal scar, and this can also result in glare. Another really common reason for eye glare is having glare after certain types of surgery, like refractive surgery. You may know this as something called LASIK or PRK, and sometimes that surgery can cause subtle changes in how your eye bends light, especially in very, very low light conditions. It can lead to glare or halos. Another common reason for having eye glare in the doctor's office is something called a posterior capsular opacification. This is abbreviated as PCO. This can happen months or even years after you've had cataract surgery. Once the cataract is removed from the eye and you get a lens implant, sometimes a cloudy film can develop actually behind that lens. So it's not in the implant itself, but it's behind the lens. And that irregularity can cause light to scatter and give you glare. Luckily, there is easy treatment for having a PCO, which is having a laser done in the eye, and this would be done by typically the ophthalmologist that actually did the cataract surgery for you. Having a PCO is not uncommon, and we see it very frequently after cataract surgery. Now, something else that you've probably heard about that can cause eye glare are floaters. So vitreous floaters are small clumps inside the eye that can move across the vision, and they can scatter light, but they usually cause temporary glare in bright light conditions. Unless you have really severe floaters, this is not going to be a huge problem for you. Another reason, which is a little bit more serious and would require medical attention in 24 to 48 hours, is inflammation inside the eye, which we sometimes call uveitis. And this can cause a lot of light sensitivity, but it's also typically associated with pain. So if you're having glare without pain, it's unlikely to be that, but of course it's always a good idea to go and check it out with an eye doctor. Another reason for eye glare that people don't often think about is having a migraine. Migraines can often cause light sensitivity, especially when you're having a migraine attack, or it can happen in the hours or minutes before the migraine starts, which is something that we call a visual aura. Now, migraines need to be treated differently than other eye glare problems, so it's important that you not only talk to your eye doctor about your migraines, but also engage your primary care doctor, as well as maybe a neurologist who can help you with this. Now, what are two very serious causes of eye glare that you really should not miss? The first is acute angle closure glaucoma. Now, this is an eye emergency. Symptoms of this include severe eye pain, headache, glare, blurred vision. You can have halos around lights, and sometimes nausea and vomiting. You will know if you're having this versus some of the other more benign eye problems because this is extremely painful and it comes on pretty suddenly. This is not something that you are going to call your eye doctor and make an appointment. This is something that you need to go to the emergency room for and get treated immediately. But again, it's typically associated with pretty severe eye pain, so you're gonna know if you have these problems. The second reason for having eye glare that is also pretty serious is an eye infection. So this is something called keratitis, a corneal ulcer, or even something more serious called endophthalmitis. But again, these are also pretty painful, pretty uncomfortable, and usually the eye is red, it looks bothered. These are not things that you're going to just have eye glare and that's going to be your only symptom. So you will know that something is wrong beyond just having eye glare if you're having those two issues. So any eye glare that's also associated with eye pain and redness, you should go in and get that evaluated right away. And this may mean going to the emergency room. Now, what can you actually do about eye glare? Well, the first thing is to figure out what the eye glare is from. So this is going to be going into your eye doctor and having them take a look to try to figure out why you're having eye glare. Now, if you've had one of the conditions in the past that we've talked about earlier in this video, you could try to address it by treating your dry eye with artificial tears, also treating any associated blepharitis. Again, there's another video on this channel about how to treat meibomian gland disease, and then also check in with your doctor if you've had cataract surgery to see if you may be developing something called a PCO. Now, one other issue that's important to mention is if you are a contact lens wearer. So if you're a contact lens wearer and you're experiencing eye glare, you may want to switch to a different type of contact lens and have that contact lens evaluated to make sure that it's fitting you well and you're actually seeing well out of it. Remember that your eye prescription can change with time. So maybe your prescription has changed and the contact lens just isn't the right contact lens for you anymore. Now, if you experience eye glare more so when you're outdoors, sunglasses that have polarized lenses can also really help. You may also want to consider getting blue light blockers in your glasses, as well as having transition glasses so that they turn into sunglasses when you go outside. All of these types of preventive care can really help with that eye glare and light sensitivity. So eye glare is usually a sign that there is something wrong with the eye. Now, it could be something mild like dry eye and something very treatable like a PCO after cataract surgery. But of course, if it's a sign of something like uveitis or photophobia from something like keratitis, those are really concerning eye issues that you really need to go in and have evaluated by an eye care professional. What other questions do you have about eye glare? You can drop them in the comments below, or if you have any other questions, I'm happy to try to address them in a future video on this channel. Thanks for watching. Hope you found this helpful. Remember to hit like and subscribe below, and I'll see you in the next video.